to get some county logos up here one day. Y'all set? All right, good morning. My name is Andy Brown. I'm the Travis County Judge, and we're here today to declare a public health emergency related to the increasing number of cases of the monkeypox virus here in Austin and Travis County. You're going to hear from me, from Mayor Adler, from our Public Health Authority, Dr. Walkes, and then we're also joined by Pilar Sanchez, who is the head of Health and Human Services for Travis County. So by the end of this, my hope is that everybody will know what monkeypox is, what the symptoms are, and what to do if you have symptoms here in Austin and Travis County. Our hope is that this declaration will help drive more resources to Travis County and Austin, especially vaccines, which we don't have enough of right now, and also more testing and quicker testing for the community. School starts next week. I've got 2 little kids that are enrolling in public schools next week. For Del Valley, it has already started. We're already seeing cases not just in local men, but also in women and children here in Austin and Travis County. I'm going to just quote from the Department of State Health Services, the Texas Department. Monkeypox is a serious illness which can be painful and require hospitalization. In recent years, the case fatality rate has been 3 to 6%, and the number of deaths from monkeypox disease has been higher in young children. This is a problem for everyone in our community, and we need to take it seriously. With limited supplies of vaccine resources, we're calling on our state and our federal partners to help us get more vaccines in Austin and Travis County. We need the federal government to increase the amount of vaccine available, and we need the Texas state government to speed up the process when we request more vaccine locally. We're ready to distribute vaccines. Austin Public Health and other clinics are ready with the infrastructure. We just need access to more vaccines. We also want the public to be aware of the risks and urge everyone to take the necessary precautions, as will be described by Dr. Walkes. With colleges, universities, schools, and festivals happening soon, happening this fall, it's imperative for everyone to know the symptoms of monkeypox and to do our part to slow the spread. Most importantly, if you believe you have been exposed or are showing symptoms, as Dr. Walkes will describe, make sure to call your health provider or Austin Public Health. And with that, Dr. Walkes, I'll turn it over to our health authority. Thank you all very much.
Thank you, Judge Brown. Good morning, everyone. Hello, my name is Dr. Desmar Walkes. I'm the Health Authority for Austin Travis County, and we are currently responding to monkeypox and its spread in our community. The symptoms of monkeypox are fever, chills, headache, achiness, and there can be the development of those things prior to the development of a rash that looks like pox, big pimples, or you can develop that rash first without those symptoms that I've just described. This particular virus has 2 forms, and the Central African form and the West African form, and the one that we're seeing here in our community is the West African form, which is not causing a severe disease. But for those who develop it or develop this rash in areas where there's particularly sensitive tissue, it can cause a lot of pain. Today we have 68 probable and confirmed cases in our county. We started with our first case on June the 23rd. This particular virus is spread by close, direct skin-to-skin contact with someone who has the rash or has symptoms of the fever, chills, etc. And when somebody develops symptoms, they are infectious. They are not recovered until all of the skin's clear of scabs and there's a fresh layer of skin. The infection is spread by the touching of the skin that has the scabs, the fluid from those lesions, and from close contact with someone and their spread of that virus in their respiratory secretions. So masking is important. We have been vaccinating our community since our receipt of vaccines. We've been working with providers in the community to vaccinate individuals who've been exposed. And we've been treating people who are eligible for treatment, who required the treatment particularly to alleviate pain. And those resources are becoming more and more scarce as we have spread of the disease in our community. So we come to you today to declare this as an emergency, as has been done by the federal government, to ask the community, as our resources become more tapped, to do what we know we can do as a community to stop the spread within our community. And that is wash hands, avoid direct skin-to-skin contact by covering your skin when you can. For those who are sick or have a rash, stay home and isolate until you recover. And for those who are in a situation where they're looking at sending children back to school, and for those who are going back to university, we provide the guidance to take measures to protect yourself in that way as well. We have made requests to the state for vaccine and for medications, and we've received some of those, both of those things up to date as of today. However, because the disease is spreading in our community, we've come to a place where those things are running out. And so we really do need our community to stand with us, as they have in many times before, and protect yourselves so that you can enjoy the festivals that are coming to our community, and so that you can continue to work and take care of your families. If you become ill, you will have to isolate at home until you recover. And that's going to be a financial drain on you and your family. So we're asking that you take those measures that we're talking about here today, so that we can get through this and bring an end to the spread of the disease in our community. And with that, I'm going to turn it over to Mayor Adler.
Thank you all for being with us today. We're going to be issuing emergency orders today, primarily for the purpose of making sure that our community knows that this is a serious situation that we should all be aware of. We're trying to increase that awareness. That's the primary reason, to make sure that the urgency is noted and communicated. At the same time, we're doing that so that people can adjust their behaviors so as to limit the spread or the potential for spread in the community. This began in isolated incidents, grew in certain social communities, but it is now clear it is spreading across all communities. I think the last numbers I heard, there were 9 women and 1 child in Texas that has been confirmed. We know that it is here in our county and in our state. As of 5 p.m. on July 29th, I think there were 351 confirmed cases. And there have been 48 confirmed or probable cases here in Austin, Travis County. Austin Public Health has received 3,154 of the 56,000 doses of vaccine available nationwide during the first phase. And I understand there are subsequent phases to come. But that means that we've gotten a pretty large proportion of the vaccine available nationally, and it is not enough. We need the federal government to do everything it can to increase availability of medicine and vaccine to our community and to others. The other reason that you enter an emergency order like this is so that we're in line and we can recover costs and reimbursement. And certainly our community has started to expend greater funds for outreach and for helping people get a treatment that's available. But I think the most important message coming out of the press conference today is for everyone to know that this is a disease that does not pass absent symptoms. But with symptoms, this is a disease that is contagious and can pass. One of the risks associated with this illness are things like having multiple sexual partners, and people should seek to limit conduct that might make them more vulnerable in this moment. Taking lessons from past epidemics, we're asking residents, especially those that are at greatest risk because of their community or social networks or their personal disposition or health, to be aware of the situation and to take steps to protect themselves and those around them. We're doing everything we can. Austin Public Health is doing everything that it can. But as we go back to school, as we move further into the festival season, as a community, we just need to be aware, and we need to take precautions as best we can. If you have symptoms, you need to isolate and act in a way that protects folks around you. You know, this is yet another time, and we've seen too many of them here over the last several years, where our community needs to pull together. But this is a community that has demonstrated a remarkable ability to do that and to take care of one another. And today's press conference is just to primarily to raise awareness that this is something that we need to do yet again.